Welcome to today's webinar, everyone. My name is Myrna Jarami, and I am the Field Marketing Specialist for Axonics Therapy. And I will be the person moderating this webinar. So before we officially get started, there are a few housekeeping elements that I need to cover. On your screen right now, I think you're seeing some important safety information. Just to say something about that, there are some slides here. These slides contain important safety information about the products you will be learning about this evening. As with any medical procedures, there are some risks. Please visit the Axonics website for more information, and remember to always bring any of those important questions that you have to your appointment with your physician. This evening, Dr. Gaynor is going to be speaking about overactive bladder, incontinence, and the common symptoms that patients experience, as well as the treatment options that may help you regain bladder control. Without further ado, I'm just going to pass the mic over to you, Dr. Gaynor.
Good evening, everyone. Thank you for being here. I'm really delighted to speak about bladders and bowels and stress incontinence and overactive bladder because that's my expertise and talk about it every day. So this is a nice way to present information to everyone. So basically, for bladders, it's very common. It affects women and men as well. And in terms of having to go frequently to the bathroom, for instance, everyone knows where all the bathrooms are on the way to work, or if they're in a mall, they know all the places, that they can go to stop. And it's sometimes it controls your life. And these are great examples down below. For instance, if someone's at a movie and they have to just leave for a little bit, come back, and sometimes they leave 2 or 3 times during a movie, and it really disrupts not just your life, sometimes the lives of your family around you and friends. So, so many people think it's a normal part of aging. It is not a normal part of aging to have to run to the bathroom often or to lose urine and to have these, tons of depends and pads, and it gets expensive, and just the pad industry or in the diaper industry for incontinence is well over $1 billion. So it's quite an issue that needs to be addressed much more often, even though it's a taboo topic. It's not just a part of being a woman, and if men have to deal with this as well, and it's not normal to have to deal with it. It's nothing that you did wrong. It can have to do with multiple reasons, whether it's hormones or surgeries and all different things. So, as I was saying, it can directly affect your quality of life as well as those around you. It can affect people with their exercising. If you don't exercise, that's going to snowball into other problems with weight gain and heart and lungs. It may not be the heart and lung, it's the bladder, but it can then snowball, like I had mentioned. And it does stop people. I've had patients come in and they're in tears because it's directly affecting their life. They don't want to leave their home. It's sad. So, it affects their social life. It affects traveling. There are people who won't go to their family bar mitzvahs or weddings or across the country, and it's a shame. And there's a bit of shame with it and embarrassment, and it doesn't have to be like this had said, and like we're saying, it's not normal, and there are multiple things that can be done, not just behavioral, for instance. It's embarrassing even with sexual activity. If some people have incontinence during sexual activity, or they're afraid that their anatomy is not normal, and they usually have really kind partners, but it's and then that falls off, and then you don't have that part of that aspect of your life. Everything snowballs into other problems, and then things can get so difficult. It can affect people's work and taking time off, or embarrassment from wetting your clothes and things like that. They're real things. So yes, you are not alone. And so in terms of stress urinary incontinence, They say 30 million women suffer from stress incontinence. Actually, 1 out of every 3 women have stress incontinence at some time in their lives. Um, so, understanding that there is stress incontinence, for instance, which it's not stress like heart stress or mental stress. It's the like think of it as a bladder urinary stress with a mechanical pressing and pushing that causes the urine to push out mechanically versus the overactive bladder, gotta go, more like a nerve type of urge incontinence. So we have stress incontinence, urge incontinence. And it is very important to understand the difference and why it's happening so that we head you in the right direction. We don't want you to have to be treated for or be treated with one thing when it's really the other thing. Or maybe you have both things. We call that mixed incontinence. Anyway, so the bladder, as you can see, the bladder is a storage vessel, and there's a valve, the opening called the urethra, and it's supposed to close at rest. That would be the normal thing it's supposed to do. And if the urethra doesn't have good musculature, or because of hormones, for instance, the tissue isn't as plump as it used to be, then the urethra can open a little. And if there's any compression upon the bladder, then that can cause that that leakage. Um, so, like I started to mention, there are treatments, and you want to just be on the correct path. So, pelvic floor exercises, or some of us call it Kegel exercises by Dr. Kegel decades ago. It's a way to strengthen your pelvic floor, and it can be anywhere from 50 to 75% improvement just from doing these exercises. It's the type of exercises you do when you're in the bathroom, for instance, and you hear the phone ringing. You stop your flow, or you slow your flow. It's those muscles. That's not when you practice them. You practice them at a red light. You do like 10 squeezes for a couple of seconds and relax completely. And you try to do these exercises like 30 squeezes a day, like 3 sets of 10 squeezes, but ideally 5 sets of 10 squeezes. And in 2 weeks, you would notice improvement. At 2 months, that's basically where you're at. So then there's other options to do. We don't have a medication that's FDA approved for stress incontinence. There is urethral bulking that's been around for decades. It started as some things that are off the market now, such as collagen and things that aren't as popular, or materials that did not last as long. Some were made out of silicone, and some were made out of like a Teflon. And we luckily have a new product called Bulkamid. It's made out of 97.5% water base, which is nice. And I'll go through that in just a little bit. And then the ultimate treatment is a sling. It's considered the standard of care. It is a surgical procedure. It does use a synthetic mesh material. So, stress incontinence, some of the lifestyle changes are, try not to hold your bladder for more than 4 hours. Do your exercises. Actually, weight does have a direct effect upon the bladder, and you could just stand up like in the middle of the night or from watching TV, and you don't feel any urgency, but the urine can leak out, and that is that abdominal pressure upon the pelvis. And then, of course, smoking, because that affects your tissue quality, and you just don't have that good healthy tissue. And chronic coughing, all those things can affect it, as well as surgeries or radiation. Um, in terms of the pelvic floor therapy, you can try to do it on your own. There's biofeedback with a computer. There are subspecialists, physical therapists that go for extra training to teach you physical therapy. They can also help with pelvic pain and things like that. So, stress incontinence, the slings have been around for well over 100 years. The sling now that's standard of care is made out of the mesh material. It's not what the lawsuits were about for when bladders were hanging down. It is like nylon or fishing line, and it's crisscrossed, and it's permanent. It can be anywhere from 85 to 95% successful. Some studies show 80 to 90% success looking out like 20 years, and it is considered the gold standard. It's if you're someone who is going to still become pregnant, we don't like to use slings in patients like that. And some people don't want to commit to having a permanent material in their body. So we do have urethral bulking agents. And now with the new material called Bulkamid by Axonics, who's hosting this talk, Bulkamid is very popular right now because it can last about 7 years, more or less. Some people need a second injection in about like, I don't know, 20 to 40% of the patients. But what it does is I don't know if you can see this caricature, but the blue dots are where a scope would go in, a needle would then inject where the blue color is. It's actually clear, and we make sure the patient can urinate after. It's quick. You can have it done a second time. There's really no downside other than if you're not able to urinate after the procedure, you may need to have a little catheter placed. So, like I had mentioned, it's minimally invasive. It has no mesh. Synthetics, it's not much of a foreign body either, because like I had said, it's made out of more natural material. And it is for the coughing and the stress incontinence, like coughing and having pressure, mechanical pressure, and having the incontinence.
Bulkamid can help provide the relief you've been longing for. The short, incision-free procedure typically takes less than 10 minutes. Involves 3 to 4 small injections of soft, water-based gel into the wall of the urethra to help prevent urine from leaking out of the bladder during day-to-day activities. It's safe, quick, and most patients can get back to your normal activities almost immediately.
So that was a nice schematic to basically show how it works. And it's like a filler. It's similar to like facial fillers. If anyone has like a wrinkle, you can use these fillers that last for like years, actually, and it bulks up the wrinkles, and it can bulk up the inner widened area of the urethra, very with minimal risk. So it is about anywhere, studies show 92% effective when you get to that steady state level. Like I said, some people need a second injection. And it's only about 4 injections, and it's very quick. Some people have it done under sedation. In my practice, we do the procedure under sedation, and it's at a surgery center. And it, like I said, it could last like 7 years. So the company, it's been out for approximately like 16 years, but it became popular a couple of years ago. So we're seeing a lot of success with it. So the next part of this is going to be about the urge incontinence or the overactive bladder that I started to mention. And we're going to be speaking about sacral neuromodulation. Axonics has come out with a product similar to a product has been on the market, or other products. There are stimulators like for back pain, or there's stimulators for tremors, and there's stimulators for bladders. It's basically the same type of company that makes a pacemaker for the heart, makes a pacemaker for the bladder. And there's like a few day test that we do, and it could be very successful. It affects about 50 million people in the United States. This device helps those nerves in the pelvis, affecting both the bowel as well as the bladder. So it helps overactive bladder, which is the urgency to run to the bathroom. You feel that strong urgency, or you're going to the bathroom every hour, or more than that even, or going to the bathroom. It's normal to go to the bathroom 1 or 2 times a night, but more than that, it's considered abnormal. So that's more the overactive bladder, putting the key in the door. We call it latchkey syndrome. That's urgent incontinence under the umbrella of overactive bladder. Urinary retention is for people who can't empty their bladder properly. You may feel like you've got to go all the time, but you would probably have to go to a urologist to know if you definitely have a full bladder. And this device, this pacemaker-like device, can help contract the bladder so that your bladder the engine basically starts to work again, and the nerves between the brain and the sacrum, the nerves at the sacrum and the bladder and the pelvis start to work again, as well as the fecal incontinence, where in cases where there's no control. And I'll talk about that a little bit more in just a second. So basically, like I started mentioning before, the bladder is a vessel that stores bladder in a relaxed manner, and the urethra, the valve, the opening, stays closed until your brain tells it that you have to urinate. Then the urethra would then relax, and the bladder would then contract and not be relaxed anymore to get the urine out, and that's all normal. Some men, for instance, may have enlarged prostates. It's stretched out the bladder, and the bladder doesn't empty well. Or because of prostates, they feel like they have to run to the bathroom frequently. So it can happen in women and men. The urinary frequency, if you want an idea of what the frequency is, really it's 8 or more times during the daytime running to the bathroom. Under 2 hours, it's pretty frequent. And then the urgency, where you feel it come on, it's strong, and you're just not going to make it to the bathroom and you'll leak. Or you may not leak, but you have that strong sense of running to the bathroom right above your pubic bone area. And the urgent incontinence is when you actually lose the urine. And like I had mentioned, awakening, 2 or more times or 3 or more times. We want you to get that REM sleep, those 3.5 to 4 hours of good sleep, providing it's not like snoring or sleep apnea. So what is fecal incontinence? It's an unfortunate syndrome, and it occurs with like the strong urgency to pass your stool. You're not able to prevent it. And then you may even leak or have a streak, or if your bladder is even full, you may also feel a concomitant feeling of having to go to the bathroom with a bowel movement, and you're just not feeling any control, and you have this strong urgency to pass stool. This device, like I had mentioned, can help these symptoms, providing it's just not diet or behavioral and other things are ruled out. So normal bladder function is the rectum fills. It has natural stretch receptors that allow the material, the bowel, the fecal material to fill. And then the nerves between your brain and the pelvis allow your bladder, or your bowel to contract so that you can empty your bowel. So you do need to have concomitantly, just like the urethra and the bladder had to relax for the urine to come out, the anal sphincter also has to relax, but you don't want it to be over relaxed, or then you can also head more so into the fecal incontinence and fecal urgency issues. Of course, talk with your family doctor first. Sometimes we have patients speak with a colorectal surgeon. For instance, there are issues such as rectal prolapse, where the inner lining of the rectum may bulge through the anus, and there are other issues going on. So that's why it is important to be assessed. When it comes to any of these things, it's good to have a diary and to jot down how often these episodes are happening, whether it's your bladder or whether it's your bowel, so that we can then direct you for the proper testing. And then we would discuss what your options are. And just like with the bladder, having, the Kegel exercises and the pelvic exercises, we can do the same. And the manometry or biofeedback, the same is done for fecal incontinence and building up that pelvic strength. There are medications that can help with these issues as well. There are side effects, of course, with medications such as dry mouth or dry eyes or blurred vision, and or sometimes the side effects pass. And then, of course, time voiding. You can just try to make sure that you go to the bathroom, whether it's a bowel movement or urination, on a regular basis, and monitoring your diet. Um, Even if you have urinary retention and your bladder's not emptying completely, then there are medications that we use mostly in men for their prostates, but they certainly can be used in women to relax the urethra and relax the pelvic floor, or to contract the bladder so that your bladder empties better. But if these medications aren't helping your fecal issues or the urinary retention and overactive bladder issues or the antidiarrheals and pessaries and everything, nothing's working, then we do have options. If it's for the bladder, there's you may have heard, besides the medication, minimally invasive options such as Botox. Botox is one option. There are risks: urinary retention, and urinary tract infections. There's like an acupuncture option that usually requires like 12 visits, a half an hour each visit, and that's done weekly. Or there's sacral neuromodulation, and I will get into explaining that in just a minute. If you are one of the patients who can't empty your bladder completely, and or it's halfway always full, or it's just full, it can lead to kidney problems or urinary tract infections. And that's why some people need to catheterize themselves. And all of these things would be discussed with like your urologist, and you'd be able to help. You would be able to make a decision on what's best for you, because it's really a team on what you are interested or willing to do to handle these unfortunate episodes. The tibial nerve stimulation, that's been around for a good 20 years. Like I had said, it's like an acupuncture where a little needle goes by the malleolus, down by the inner ankle area. And it's 30 minutes at the doctor's office every week. In about 5 or 6 weeks, you may notice some improvement of like your overactive bladder. It may also help with urinary retention. And if it helps you, then you go back for another few months for weekly sessions as well. And it is covered by insurance. All of these methods are covered by most insurances other than deductibles and things like that. So Botox is done either in the office or under anesthesia, depending on your pain tolerance. And it's a scope that has a needle that directly injects the bladder like 10 times. It could be as much as 20, but some people have looked at 3 or 5 times, but it works best with 10 times. And that takes about like a couple minutes to get done. It's the same Botox for like wrinkles, and it lasts about 5 months. That's an option. And then there's the more advanced option, which is still minimally invasive, where a needle is just placed for sacral neuromodulation testing. It's done in the office. You can drive yourself. You can have all your medications and eat whatever you need to eat beforehand. You just lay on your belly. We place some betadine at the level of the coccyx bone and a little bit above that tailbone, that sacral area. And I, or whoever your urologist is, or whomever, would numb you with some lidocaine, and a little needle is placed through, like if you have a sacrum and here's the coccyx bone, the sacrum has holes, and a little needle is placed through the hole at the third hole. It's a third sacral nerve. And there are nerves that run right underneath the sacrum that go directly to the bladder and the bowels. And so the needles exchange for a flimsy wire, basically nice soft wire or two, and taped down for a few days. And then the wires are taken out. Hopefully that night or within 24 hours, you should notice dramatic improvement. This has been FDA approved since 1997, but in the past few years, companies like Axonics has made the device last more like 15 to 20 years, and it's now finally MRI compatible, and you can wear it on planes and everything. So it's nice. And some, let's see. So sacral neuromodulation for, like we had mentioned, the overactive bladder, urinary retention, as well as the fecal incontinence. That's been FDA approved for well over 5 years now. So it's the connections between the brain and your pelvis, or the brain and the nerves from your bladder. We call them efferent and afferent nerves, as well as the nerves from your bowel, are directly affected along the spinal thalamic pathway of your vertebrae, like in your back along the spinal cord. There's no downside. There's never, thank God, there's never been documented any kind of like nerve or issues like that. It's just that when we have PET scans and we do studies, if you turn on this like pacemaker device, we see the areas in your brain that control, for instance, urination or bowel function, they light up. So we know that there's a direct communication to the brain as well as to the bladder. And it's about just restoring that normal communication and get things to work. It's like rebooting a computer and making it work normally again and having a normal life. So, like I mentioned, there's that thin wire. You go home, you keep track with a diary of how well it's working. And if you are interested in having a battery, you would have an option of having one that's like really just a chip that's I don't know, about half the size of my thumb and half the width. It's very thin, and it's a very simple fob. You don't even have to really use this fob too often. Like once you get the battery, it's all set up. The reps are very attentive, and it's very easy to contact the company, but you also can come to your doctor's office as well whenever it's necessary, after the healing and after, the wound checks and everything like that. And it should last 20 years. There is that one, this tinier one though, you would charge it anywhere from every 6 months to every 10 months. So it could be any, like, once or twice a year, you charge your device with this device. You put it against your back, like when you're watching TV for 45 minutes, a couple times a year. If you don't want to do that, or you get sick of doing that, you can then change or start with a pacemaker size, which really isn't much larger than the smaller device. They call this the F15 device. It's a battery, it's a pacemaker, and it just goes into your hip area, deep underneath that. Some of us have that nice fatty area in the hip area, and so it's placed there, and it connects to a permanent wire that's placed with x-ray imaging in a second procedure, and it's just done under twilight. So that's that. It really changes people's lives, and you don't have to have the side effects of medications or coming back on a regular basis. It's been new and improved, and it's really helped people in so many ways in their social lives and everything. Usually this fob is put away in like a little drawer. Unless you need to have an MRI, it would be nice. You just basically just press this round button. It turns on the device if ever you have to make it go up or down. And you really just feel like a little vaginal or scrotal perineal vibration, and then it goes away, but it's working. And you could hit the down button all the way down if ever you have to have a procedure or surgery or MRI, and then you just turn it right back on. And it's very simple. In the past, other companies have used like iPhones, and it's pretty complicated, but we've been very happy with this. And like I had mentioned, it is MRI compatible, which is wonderful. And the therapies I'm sorry, the success rates, I had done studies specifically on sacral neuromodulation during my fellowship at University of Iowa, and we would see anywhere from 85% for urinary retention, which is very difficult to get the bladder to contract again. We don't really have many options for that, but some people like an option more than just a catheter. So there's that success. But with overactive bladder, fecal incontinence, urinary incontinence, remember, this is not for the coughing, sneezing, leaking where the urethra is open. This is for the nerves, where the bladder's spasming, basically, to put it simply. And that's up to 95% successful in majority of studies. I know they say 93%. But either way, it's excellent improvement. So, and the satisfaction rates were extremely high. And like I said, it really changes people's lives.
I guess this brings us to the end of this evening's webinar. Dr. Gaynor, thank you so much for your time. Everyone, thank you so much for joining us this evening. We hope you found this presentation very beneficial. Just as a reminder, if you have any questions or want to inquire more about anything that you've learned in tonight's webinar, please schedule an appointment with Dr. Gaynor. Those are her contact or her location numbers to do so. And she'll be able to answer you even further in any questions or inquiries you have. Thank you again for joining us this evening.
Thank you for having me.
We hope you enjoy the rest of your evening. You're very welcome, Dr. Gaynor. It's been a pleasure.
Thank you, everyone.